This is a surgical technique of anterior capsule reconstruction with Acellular Dermal Allograft. The patient is placed in lateral decubitus position. Posterior, anterior superior and modified mid-glenoid portals are established. A standard diagnostic arthroscopy is then performed within glenohumeral joint, and each pathology is appropriately addressed. The subscapularis tendon remnant is released, and if tension-free repair cannot be accomplished to the native footprint, we proceed to the ACR technique. We begin with clearing out the space and preparing the bed for the graft. The rotator interval is widely open. The coracoid and conjoint tendon is identified and lesser tuberosity is completely exposed. Once it's done, anterior glenoid neck is biologically prepared. The dimensions of the future graft size are measured. The medial lateral and superior inferior distances are measured. Two single-loaded anchors are placed in the glenoid neck, one at the inferior portion of the subscapularis remnant, and the second is placed at the top of the subscapularis remnant. The graft is prepared on a back table, sized and trimmed accordingly to the previous measurements. The medial edge is marked with a marking pen for future identification. The medial fixation is accomplished through a double play technique by passing one limb from each suture anchor through the medial aspect of the graft outside the shoulder. These limbs are then tied together over pickups. The graft is then rolled, and the grasper is used to insert it through the cannula at the mid-glenoid position by pushing the instrument into the shoulder. The lateral graft is secured using double row suture speed bridge technique. Before that, a temporary suture may be used for graft positioning and tensioning. The glenoid anchors limbs are then pulled from the mid-glenoid portal and tied to each other. Two single-loaded anchors are placed in the humerus approximately 5 to 8 mm from the bicipital groove. The anchors should be placed as far apart as possible, but within the dimensions of the graft. Two sutures are passed through the graft approximately 1 cm from lateral edge of the patch, one in the superior and one in the inferior corner. After the two holes are punched in the bicipital groove, one limb from each suture anchor is then retrieved and is loaded into the knotless anchor. The anchor is then inserted into the superior hole located in the bicipital groove. The second suture pair is loaded into the second anchor and inserted into the inferior hole, completing the double row repair. Once the graft is secure in its place, the edge of the patch can be also attached to the subscapularis remnant with a simple stitch. The humerus can be gently moved to inspect tension and response to motion. Visualization of the glenohumeral joint final view shows that the anterior capsule is reconstructed and the procedure is complete.